Are you experiencing knee pain when running, walking, bending your knee, or even going up and down the stairs? Well, you might be surprised to learn that the cause of the knee pain may not be coming from your knee. It could be coming from the muscles above and below the knee. Hi, I'm Lori. I'm a certified massage therapist focused on structural realignment and whole body integration. In today's video, we're going to discuss how muscle tension in the leg can actually cause your knee pain. Then we're also going to discuss different scenarios where you want to check with your physician and get the pain checked out by a professional. We're also going to discuss different scenarios where you feel the pain depending on the location of the pain in the knee. And then also we're going to share some self-care tips to help you do some stretching and other things that can help you ease the pain and also prevent it in the future. Let's talk about how tension in the leg muscles can actually cause your knee pain. For instance, there's the hamstrings, the adductors, you have your IT band, and then below the knee, you have your calves, your peroneal muscles on the sides, and all of those muscles come up and they come around the knee and attach on the opposite sides of the knee from where they're located. So that way you can bend your knee, you can move, and perform your daily activities well. So when there's tension in these muscles, it can actually tend to pull your leg, your hip, everything out of balance. And when that imbalance is there, the tension on the attachments around the knee can become really tight. And a lot of times that will cause the pain because the muscle is getting pulled on that attachment. And that can create a lot of discomfort. This discomfort can be felt on the front of the knee, on the outside of the knee, on the inside of the knee, and also below the knee as well, just because of how these attachments come together. When we're looking at muscle tension in the leg around the knee, we don't want to just look at one specific group of muscles or one part of the knee. We want to take pretty much a 360 overall full body approach, because the body is a compensation machine. Where one area is tight, it's going to affect another area. So that way your body stays in a center line and you're not walking around going sideways. So the body starts compensating, and then you start feeling, oh, it's in my knee, then pretty soon it's in my hip, then oh, now it's up in my neck, just because the body is creating that pattern. So you want to not just look at the knee unless it is something like arthritis or something more serious that you need to check with your physician. We'll talk about those situations here in a minute. You want to look at the whole leg and the whole body. Also, when there's tension in the legs, it can throw off the hip, and vice versa. If there's tension in the hip and there's an imbalance there, say one hip is elevated, that's going to have a major impact on your leg, because then different muscles are going to be pulled and stretched in different areas. And then a lot of times you'll end up having one leg that works harder than the other due to this imbalance. You want to make sure to check with your physician if you've had an injury to the knee or the pain is accompanied by popping, swelling, difficulty putting weight on it. Any of those situations, you want to make sure to check with your physician, because massage, strengthening, stretching, all that can do wonders. But if there is something more serious going on in the knee joint, then a physician definitely needs to check it out for you. Now we're going to discuss 3 common scenarios where knee pain can be experienced. The first scenario involves knee pain when walking or running. The muscles in this scenario include the IT bands on the outside of the legs, the quads in the front of the legs, and then also, surprisingly, the muscles on the inside of the legs, the adductors, such as the gracilis. In the clients I work on, I have discovered there's 2 situations as far as tension in the IT band. It can be very tight, where it's actually pulling the person down into the side because it's compressing and coming together. And then the other situation is where the muscles on the inside of the leg are the ones compressing and creating kind of this knock-knee, bow-legged type inward shift of the leg, so that it comes in kind of like a V at the top of the leg. So what that does is it elongates the IT band. So the IT band's actually getting stretched and pulling on the attachments. The second scenario is knee pain when squatting or bending. The muscles in this scenario include not only the muscles in the upper portion of the leg, like we just discussed, but also the muscles in the lower part of the leg, such as the calf muscles, and the muscles in the front of the leg. So you have your foot flexors, especially along the outside where there's a muscle called the peroneal muscle, and that will get very tight. You may have experienced this pain in that area when you've been on a long road trip and your foot has been on the accelerator, or it's a lot of stop and go traffic for a long period of time, and then pretty soon you feel that pain on the outside of the front of your leg, pretty much between your foot and then towards the attachment of your knee, and that's due to those muscles getting tight and getting overworked, so that'll cause pain in that area. Also, what can happen with those particular muscles is when you're doing a squat, it can actually change the direction of your foot. So that way when you come down, it can pull it outwards, kind of like a duck pattern. And what that does is it tends to make things a little bit more off center and not quite so mobile and stable on your ankles. So then what happens is you don't have that stability to support yourself going down and getting back up during a squat, or just bending down to pick something up. In addition to the pain, you could also feel a weakness in the knee when you're bending down and trying to get back up. Maybe you need something to hang on to bring yourself back up after getting down, just because you can't support yourself. A lot of times that's due to weakness in your legs, and many times if you strengthen your legs, especially the quads, the hamstrings, of course getting up into your hips, it will actually help make your knees stronger, because it will help with a more stabilization of your knee. I used to work for a company and I had weak knees. I remember going to get my food out of the refrigerator to heat it up for my lunch break, and I had my hands full, and I went to bend down in the refrigerator to get my items, and I stood back up and I couldn't support myself, and I actually fell down on the floor because my legs and my knees gave way, just because I didn't have that strength and that support. So of course later on I learned what I learned, and of course strengthened my legs, and after that I have no problem getting up and down. So having the strength up and down your legs and into your hip is very important for your knees, for stability, and also for pain management. The third scenario involves pain behind the knee or on the side of the knee. Two big muscles that can affect that are in the calves, which are the gastrocnemius and the soleus muscles. When those get very tight, they attach up around the opposite side of the knee, and what happens is it compresses the knee and it tends to pull it backwards instead of staying nice and straight. So you lose that stability in your knee. Now we're going to discuss some self-care strategies that may help you find relief from your knee pain, or else even prevent future knee pain. Let's break down this part of the topic in 3 different areas that include strengthening the muscles of the legs, stretching the muscles of the legs, and also the importance of hydration. Strengthening the leg muscles can help decrease the risk of imbalances, not only in the leg, but in the hip and around the knee, and just provide more stability to help you stand up, to help you move, and to help you reduce your pain. Simple exercises like lunges, step-ups, and glute bridges can help create stability all the way up and down the leg. Something that has greatly helped me is going to the gym. I know not everyone is able to do that, but if you are, it's extremely helpful, especially when you go to the area that has the leg equipment. When you start working out, you'll start feeling the areas where you have the imbalances. For instance, there is an adductor equipment that I use, and then an abductor equipment that I use. So I feel strong when I take my muscles to go outward to do abduction. And even then, I'll notice I'll have one side of my hip that is stronger than the other. And then when I bring it back in for adduction, I notice my muscles are very weak. So of course you can feel that imbalance, how inner weak muscles and then imbalanced outer leg muscles can throw everything off. So when you go to the gym and you look at the different equipment, a lot of the gym I go to, they have the different pictures as far as exactly what leg muscle group you're working. And I would highly recommend if they also have the ability to have someone that can help you kind of do a run through of the equipment. So, and you can explain your situation as far as where you're feeling weakness or where you think you need help in your leg. Many times they can help you pinpoint that and strengthen the areas that you need strengthened. Now I'll demonstrate some ways you can stretch different areas of your leg, starting at the top of your leg, around your hip, all the way down to your heel and even into your foot, because some of the muscles wrap around at the bottom of the leg into the foot, which can also help with maybe plantar fasciitis and different pains that you may feel in your feet and toes. You want to remember to do the stretching in conjunction with the strengthening, because you want to stretch out the muscles that are compressed and tight and pulled together. So you want to stretch those out, and then the muscles that are overstretched, you want to bring those together. So you want to strengthen those. Now I'm going to demonstrate some stretches that have been very helpful for my clients. It involves the quad stretch and then some stretches for the inner thigh. So what you'll do for the quad stretch is find a low table or chair or bed. And instead of grabbing your leg and doing the typical quad stretch, because it kind of contorts your back and shifts your hip, you want to keep everything as straight and parallel as possible. So what you want to do is just put your knee, bend your leg up on the bench or table, and then just go straight forward and slowly go down. Don't try to arch your back or put pressure on your low back. So you want to make sure just to go straight forward. And what that does is it stretches the quads, which attaches at the knee and then goes all the way up. That stretch gets pulled all the way up, and you might even feel it clear up into your rib cage because it goes across the front of the hip as well. And so you hold that just until you start feeling a little bit of release. You don't want to go too far or too long, because you don't want to cause more injury or more discomfort, but you do want to hold it for a little bit to where you start feeling that stretch and things release a little bit. So then you want to remember to do the other side as well. So you'll bend the knee again and go straight forward, just like the other side. You go straight forward just like that. And if you want, you can also do a few of them, or you can just hold it and then stretch into it. Either way, whatever works best for you. Just listen to your body and then go from there. And then also a stretch you can do for the inner thigh is the usual, go down like that and stretch it, come up and then go down. You'll really feel that as well. And then what you can do too is you can use the low table or bench again and come to the side and then do a side stretch down like that. As long as you're able to stabilize with the other leg, you can do that. And you could go up and down a few times, or like I said previously, you can just stretch it and hold it as well. Just kind of depends on what strength and everything you have in your other leg. So you can do that, and those stretches have actually helped my clients quite a bit. Now I'll demonstrate a more advanced version of those stretches I was just mentioning. You only want to do these when you start getting more range of motion, because you don't want to overdo it. These tend to be a little deeper and more intense than the other stretches that I just showed. So what you'll do, similar principle, you want to stay as level and even as possible and do both sides. So you'll go straight forward and then stabilize your leg. And then you'll come down and you'll do a nice long stretch. And then you can kind of also lean into it, kind of lean down into that stretch. And then you'll feel it all the way up in front of your hip, even up into the bottom of your rib cage. And it feels pretty good. So you want to do that on both sides. And then a more advanced version of the inner thigh stretch is you can come down and then stretch it out like that. This one you got to be really careful with that you're able to stabilize really well. And then you just kind of slowly go down into it. Like I say, you don't want to overdo this. Just listen to your body and then go with whatever you feel is comfortable. Now demonstrate a good stretch for the back of the lower leg, the calf muscles. So what you'll do is you'll stand up and you'll take one foot, again, as straight and parallel as possible, and you point your toe forward and then slowly stretch down onto that. And again, you can go a few times, you can hold it. Like I say, work with your body and do what helps and what works for you. And then, of course, do both sides again. So then you'll do the other foot and then bring that forward and bend that down. And that's a really good one for stretching out the calves and the back of the leg. Now I'll demonstrate a good stretch for the hamstrings. So what I like to do is I'll stand and I'll put my leg forward like that and then just slowly lean forward. And that not only stretches the hamstrings, but it starts to get on the inside of the leg as well. So it creates a really nice stretch all the way down that goes in even into the back of the knee and really helps open up that connective tissue. Now I'm going to demonstrate some great stretches, not only for the IT band, but the foot flexors as well, right here on that front of the side of the leg, just as I was speaking of earlier, that can cause a lot of pain, especially in stop and go traffic. There's a couple stretches that you can do that get into the IT band and also into the upper hip where the attachments are for the muscles in the leg. So what you'll do is you'll bring your leg across, take your hands, cup them together, and then gently pull in the opposite direction. I'm sure this is a common stretch that you may have seen recommended by many people, especially physical therapists. So it pulls across there, so you'll feel that stretch all the way down in the back of your glutes into the piriformis and some of those attachment muscles, like I say, for the leg. And then the other thing you can do to get more down into the IT band is to bring your legs down, take your other leg, bring it across the knee, grab hold of something on the floor, or try to keep your hips as level as possible, and then use your other leg to rotate. Rotate like that, and it really starts pulling down in through here and getting that stretch going in the IT band. Another stretch that I really like while you're in this position to kind of open up the joint area of the inside of the hip, especially if you've been sitting a lot during the day, everything can just get kind of compressed and squeezed in that area. So we'll bring the leg up, and it feels really good to just rotate it out and bring it down. And that kind of opens all of this up, and then also you'll feel a stretch and a pull through this area as well. So you can try that out. It feels pretty good. So you want to do that on both legs again to help kind of open up the hip joint where the hip connects to the leg area. And you might find that very beneficial. While you're in this position, this is also a good start for doing the muscles that I was speaking of earlier that get really tight on the front of the outside of the leg. So again, you bring your leg up, you kind of bend out, and then what you want to do is with the opposite hand, grab the front of your foot and take this hand, the opposite hand, push it kind of against your lower leg, and then pull down into the inside. And you'll feel a nice stretch right through this portion of the leg that I was talking about earlier, that peroneal area that can get very, very tight and cause more instability down in your foot and your ankle. So again, bend your leg, bring the other hand, grab the top of your foot, push down with this hand, and bend your foot down and inward. So like I say, you'll feel that all the way from around the knee area here, all the way down in through your ankle and through the top of your foot. These muscles in the front of the legs can also be very challenging to get relaxed A lot of times you'll see foam rolling for like the IT band or foam rolling for the hamstrings or the calves, but you don't really see a lot on how to release the tension in these muscles right here. So what you can do is, you'll feel it. It feels like a very, very tight band that's right next to your shin bone, right in the front here. You'll feel that. And then you go to the outside and you'll feel it run all the way up and down from the knee down into the ankle. And it will be like a rope. And the majority of people that I've worked on, there's very, very, very few people in my experience, in my years of massage, that do not have tightness in this area. So you can take your hand, and when you feel that rope, you just work it back and forth. Really get in there and work it back and forth. And a lot of times there's trigger points along these areas. And what that means is that there's tender points that will refer all the way down into your foot. And sometimes it may cause your foot to jiggle a little bit, especially if it's been really tight for a long time and chronic. So take your fingers and just go in there really good and go all the way up and down, all the way up and down the leg there. And you might feel it start to get a little tighter around the ankle and go back up. And sometimes it'll feel, it's kind of one of those hurt so good feelings where it starts tingling down into the foot and down into the leg. It feels it's kind of funky a little bit, but as you keep working it, it'll get looser and looser. And like I say, you'll start to feel a tingle. Actually, I'm feeling it underneath my heel going into my foot. So these muscles are very connected to the foot. They actually attach in the foot. And when these are tight, you might start having some toe problems, some foot problems that have start to appear. So if you can work this area really good, you might notice some of the pain or issues you have in your feet might subside as well. The third important step is to drink a lot of water. The body needs water, especially the connective tissue that surrounds everything. It can help with not only your knee pain, but the pain throughout your body. And I would recommend drinking electrolyte water, especially because the potassium, the calcium, and the magnesium in that can not only help with the muscle spasm, it actually helps with the nerves leading to the muscles that can help calm everything down. And without adequate fluid in the body, the connective tissue can become very sticky and stiff, which will also limit your range of motion, and you'll find that you won't be able to move as easily. You may have noticed when you sit for long periods of time, there hasn't been that fluid, the lymph going or anything like that, and you go to get up and you go to move and you're like, oh boy, that is really stiff. Well, that's part of it, especially if you haven't drank a lot of water or if you drank something that can be very dehydrating, such as soda, and that can cause a lot of fluid buildup in the legs. So when you start to move around, everything has been pretty much compressed and stuck. So once you get to moving, walking is really good for that. So once you get to moving, it pumps that fluid back into the joint and hopefully brings that pain down and that stiffness down. Thank you for watching, and feel free to subscribe, like, and share this information with someone you know that may be dealing with knee pain or just want to prevent future injury.